Well, we move on to a series of conversations now that will be delivered in the form of Tri-Talks. Think of a TED Talk, but this time for Trilogue. This is where we have individuals who'll be sharing their perspectives and stories, and most importantly, learnings that we can impart on to truly understand how it is that ICT has influenced the socio-economic environment in terms of inclusion, ICT on women, as well as the influence that ICT has had as well on the future of labor and how it is that will remain productive. Now, we want to get your views and your thoughts on this because for many of us, every day has been a touch point and element of interaction with technology. Your mobile devices, the interacting on the platform, all of this would not be made possible without us having access to ICT and knowing how to use it adequately. Well, our first speaker is going to give us some insight into technology for social inclusion. Now, for you and I, we've probably heard the words, "You're on mute," "I'm about to share my screen," and maybe even establish the difference between a 2020 meg line and just how far 5 gigs of data can get you. But we're the lucky ones because we have access and the ability to understand how these tools afford them, and most importantly, use them for our day-to-day operations. But what does this mean for the broader landscape of South African society, and how do we ensure that these small privileges that you and I get to enjoy become a basic human right for everyone? Well, to give us further perspective on this conversation and primarily based on ICT for social inclusion, we're joined by our next speaker, Gustav Prekelt, who's a well-known entrepreneur, technology speaker and founder of Prekelt. Ladies and gentlemen, a warm welcome to Gustav.
Hello, everyone. And I just want to thank everyone for Zooming or dialing in or using your new technology or your phone or your laptop to connect. I think we all are learning a lot of new ways to communicate with technology and connecting remotely. I'm here in very beautiful, sunny Cape Town, and it's just a real privilege to be speaking to everybody today. So I'm gonna be chatting to you about technology for social inclusion and specifically how we lessen the digital divide and how can we use technology to improve people's lives using technology at massive scale. In keeping with the theme, we have a poll today. We're going to see how this works. We're gonna bring this up now. You can see here during COVID-19, what was the form of communication you used the most? So I'm really interested to find out, and we're gonna come back to this. So the choices here are video conferencing, like Zoom or Team Chat or WhatsApp. Have been using SMS, or lo and behold, have you still been doing in-person meetings during the lockdown? I'd love to get your input on this, and we'll return to this at the end of the call. So let's go to the next slide. Thank you. I think so. My name is Gustav Prekelt, and we've been working. We run a nonprofit that builds technology to help scale social impact for profits and governments around the world. And I think what we've found over the last 10 years as we built our technology and as we worked with organizations is technology has grown and increased and made it been ever more available in a universal fashion. So more and more people have been able to access information at the right time to improve their lives. We started a couple of 100 years ago with print. That grew to electronic media such as television and radio, and steadily, as you probably know, all these technologies start out by being made for the elite, the most affluent, the people that can afford to access information. But then over time, these technologies become more democratic and more people can access information. And so we saw that with every new technology that gets evolved or gets delivered into the world, we see more and more people start using that technology for day-to-day communication. And we saw that with telephones. I don't know if anybody is old enough to remember the launch of mobile phones, but in 1994, it was not a tool that was originally envisioned for everybody to utilize. Yet here we are now in South Africa with every single person in South Africa basically has a mobile phone, and we can communicate to them. And I think what we specifically want to focus on today is growth of social media and chat platforms. So we've seen over the last couple of years as communication went from a one-directional medium, such as television or radio, that you could just consume information, to a bidirectional medium. And you saw in the video just now around the national helpline, the GBV helpline that Vodacom sponsors, and through some of the other services that we've been launching over the last couple of years, is we can now take an information service like a SMS or WhatsApp or social media service, and we can provide a return path for our end users. In other words, we can create something that's much more relevant to them. So not only can we personalize it, in other words, we can say, based on, for instance, your pregnancy or the problems that you're experiencing, I can tailor the information directly for you. We can also allow you to then dig deeper, ask questions, and provide you personalized advice, personalized information to help you on the behavior change journey that you need to take to improve your life and your well-being and those for the loved ones around you. If you can go to the next slide. So our background over the last 10 years, we've mostly been working with governments and with nonprofits. And I think some of you might have heard of Mom Connect, which is now one of the largest, if not the largest, maternal health program in the world. And it's a South African invention. It was pioneered by the South African Department of Health. And it's now been running almost a decade. We have more than 1 million mothers in South Africa that are signed up. So in any given year, we have almost 80% of mothers in South Africa that are signing up into the program. And its premise is that we can provide information on a personalized level for every mother during a pregnancy, exactly at the right time during the birth of a baby. And then after she's had a baby, also provide her with personalized information around the health of the child, and then as the child goes into creches and ECD centers. If you can go to the next slide. And here's a great example of that. Now, this service we originally launched, very naively, we thought, well, if you provide the right information, all we really need to do is send SMS to the end user. You see an example there. Free ARVs at the clinic will help prevent transmission of HIV to your baby. Go now so you can protect your baby and stay healthy yourself. Now, we rolled this program out, and every single mother that goes into any public clinic is signed up for the program and starts receiving these messages. But I think the thing we learned over the last couple of years is that by providing a return channel, you can see here, the mother receives a message and she's unsure of what she needs to do with that. So you can say, well, you know what, I'm HIV positive. Is it possible to breastfeed my child? And then we can provide her with information. So, for instance, breastfeeding is still the best way to feed your baby, even HIV positive. The ARVs that you're on and the medication you get from the clinic for your baby will help stop your baby from getting HIV through your breast milk. It is very important for you to stick to the medication that the clinic gives you and your baby. And I think here's a great example of outbound messaging personalized to the mom, but then with feedback information back through the SMS channel. And I think what we learned through that is that there's a huge appetite for interactive messaging, and specifically for services that provide personalized advice. If you could go to the next slide. I think what we realized, though, is during the time of COVID-19 is we also need to be able to respond in times like COVID-19 to fast-moving events. Mom Connect was a long program. Thinking those, we were in the position that we could respond to the COVID-19 crisis in the beginning of the year when lockdown. As it says, during times of fast-moving change, the problem is that you can't get information out to large audience fast enough, and specifically interactive ways. So, for instance, when a new virus hits, science knows about it can change from one day to the next. Since our advice during lockdown, as we went through the various lockdown levels, we needed to provide that information. Now, we do have broadcast media to do that, but how do we provide personalized information, for instance, based on your location, your state of health, or other information? And luckily, we were in the position to be able to do that. I'm going to go to the next slide. So that's in the unique position that we had the only national scale health line, a WhatsApp line available which was Mom Connect. And as we went into lockdown, we worked with the Department of Health to think through the information that the Department of Health needed to get to every single person in South Africa. Now, remember, the whole point here was not just to make it available via website and via information that you needed if you're affluent, but to make it available to every single person in South Africa. And you can see there on the right, that was COVID-19 Connect that we launched on the Contact NDOH line. That was one of the first on the planet that launched, and very soon we started working with the World Health Organization to make the same information available on a global scale. And you can see there, and it was really interesting, I think, to this point, one of the things we learned over this crisis is when you're on a fast-moving environment, you need to be able to launch information really quickly. And you need to be in a position that you can modify that service and update it and add new elements to it as the need arises. So by now, 7 months later, the service has evolved quite significantly. And over time, we've added a lot more features. So for instance, we were able to support the government, the tracking and tracing program. As the app launched, we were able to do that. We were able to add additional information. But I think the key thing here was to have a system that you could modify on almost a daily basis to provide information and feedback to the end users. You could go to the next slide. So this is some of the really incredible results that we had. Over 8 million people. This is now one of the largest interactive services in South Africa, not just houses. We hardly any websites that have this many users in South Africa. So the code line in South Africa has got 8 million subscribers now. On any given day, we'll have hundreds of thousands of users still returning to the line to get up to date. And I think, interestingly enough, as the COVID pandemic has changed, the information that has been delivered has changed. So instead of, in the beginning, just providing clinical information, now we're thinking about how do we safely reopen schools? How do we provide support to small businesses as we reopen the economy? How do we deal with the effects of the COVID pandemic and provide the right information to people as we get out of lockdown? If you can go to the next slide. I think what is really amazing and gratifying is how the work that we were able to do with the Department of Health in South Africa, and led by our minister and the DG here, how we were able to leverage that and support the World Health Organization, which then very soon after we launched the South African line, were able to support the World Health Organization to launch a similar line, which is the Health Alert app, which was launched on WhatsApp for them, which now reached over 10 million users. If you can go to the next slide. So just an overview, just over the last 6 months, and I think this speaks to the ability, technology really to be able to make a universal bidirectional communication channel available for long-term behavior change and for short-term responses such as helplines. So you can see here now in total over the last couple of months, we've reached over 20 million users through these health lines. Almost 500 million messages have been sent just around COVID-19. We've now translated service into 18 languages, and over 10 national governments, subsequently to South Africa and the WHO, another 10 national governments globally have launched similar technologies based on the original work that we did. And I think it speaks to the ability to simple technologies like WhatsApp to provide information in real time in an encrypted fashion to everybody. If you could go to the next slide, please. And so I would like to end, I think, on something that we are very proud of that's launched over the last, literally this Saturday. And I don't know how many people here know, but World Mental Health Day was on the 10th of October. And we were able to support the WHO to launch a digital stress management tool. And we're particularly proud of this particular service because one of the side effects of COVID-19, the unintended consequences being we have all been locked down into our houses. As you know, probably in Europe, a lot more countries are now going back into lockdown. I think the Netherlands are going back into lockdown today. And there are other effects to COVID-19 apart from the clinical effects. Now we start seeing things like depression and mental health issues starting to come to the fore. And one of the big challenges we have around the world and in South Africa is how do you provide support to patients and to general citizens around things like mental health when it's not something that's easily accessible in the first place. So we're very happy to have been able to launch that. I thought for today, you'll see there's a QR code there. I hope that if you have your phone out, you can use either Android phone or iPhone. You can open WhatsApp or you can open your camera. And I'm actually going to do this now. And I hope you can, it's a nice interactive, so open your camera and point it to the QR code. Hopefully you can see this here. And take a picture of or just point it, if you're on an iPhone, you can just point it at the QR code and it will start the conversation on WhatsApp automatically. So if you're in WhatsApp, you can just point the camera there or otherwise. and you can it'll start with it'll open the World Health Organization with a text saying breathe, and that's the keyword that kicks off the mental health communication. You can see there what that allows you to do. Now, at really massive scale, we're talking about tens of millions of people are now able to take this de-stressing journey. And it really is, I think it points to the start of these universally available tools that we can make available, not just for health, but for other behavioral conditions such as hypertension, diabetes, stress management, weight management. So anything that potentially would take a long period of time to have you change your behavior, we can provide you with personalized information. I think all the organizations here are thinking about how do we scale our impact? How do we provide information in real time to our end users? So we're particularly proud to be working with the organization, with the Department of Health. I'll be inspired by the work and the information that they do, and to be able to provide the technology to help them. Maybe we can pull up the pulse and see people have been doing during COVID, and I think that's really wow. That's I think what's really interesting here is if you see phones and SMS and in-person meetings have basically dropped to almost to zero, and video conferencing, WhatsApp, not a surprise, are the two media that almost everybody on this conference have been using during COVID. I think that's a good indication of what we should be thinking about as channels to be communicating to provide social impact. If you go to the final slide. So with that, I would like to just thank you for the opportunity to speaking to you. I think we all know in our hearts, and we have a hunch that technology can be transformative in providing social impact services. But I hope that some of the examples we showed here gave you some inspiration and maybe some pointers to providing ideas around the types of services that you might have thought or are extremely complex to do via digital means. I think now with the advent of tools like WhatsApp and the fact that we can do media and audio and interactives, we can deliver really complex social impact services to support people in all walks of life. And thank you so much.
Thank you so much, Gustav, for that presentation. I think really interactive and building up on the way that we need to view technology, not just as a basic tool of communication, but really one that can assist in terms of healthcare. I do want to just provide feedback that I have used the QR code and have already started interacting with the feedback from the World Health Organization. I'm sure many of our delegates have too. So quite interesting to see how prompt, how immediate many of the responses are, and also how simple it is to use in terms of some of the steps to follow. So really speaks to how technology is changing our life. I do very briefly want to take an opportunity. Gustav asked you to answer a few questions, right, in the poll. And I'm really intrigued to see some of those results that have popped up in terms of during COVID-19, what was the form of communication that you used the most? No surprises here. Of the options that you were given, video conferencing, phone calls, WhatsApp, SMS or in-person meetings. The one with that certainly takes the lead has to be 70% video conferencing. And I guess that's the basics of what we've witnessed, right? With many of these new technological platforms being quite imminent, and us even using some of them in terms of our interaction here today in getting some of the speakers to you. So WhatsApp follows closely at 27% and phone calls at 1%. But quite interesting how video conferencing now appears to be a norm and something that we're quite used to, just as long as your mic is not on mute.